So good evening, everyone. Thank you to those of you joining us live and to those of you that may be catching up with this later on. So we are well within May now, at the very end of May, I should say. And as so many of you know, this month has been Skin Cancer Awareness Month. And we at the Skin Collaborative have been campaigning all month about really keeping it simple to let you guys know about the importance of keeping an eye out for the signs of skin cancer primarily. So I have the pleasure of welcoming Dr. Delaram Zahedi, who is an ambassador for the charity Skcin, who we've been working very closely with this month. So welcome, Delaram.
Hi, thank you.
Thank you for joining me this evening.
My pleasure.
It's really a little bit of a brief introduction, but obviously if you want to just explain a little bit more about your role with Skcin and what you do, you're a doctor obviously, so over to you.
So yeah, my name's Delaram. So I'm currently a junior doctor at Salford Royal in Manchester, and I'm due to start my speciality training in dermatology in August in Liverpool, which is very exciting. So I've been a Skcin ambassador since 2018. I mainly attend events to be able to promote the charity, to spread awareness about the education programs, and I sort of dip in and out around my doctoring as well. The charity is amazing. It's given me so many opportunities to do things that I ordinarily wouldn't have done. And so today I'm here to talk to you about skin cancer, to talk to you about sun safety, and a little bit about the charity as well.
Fabulous. Well, I am excited for this. I'm sure our viewers are as well. I'm just going to pop my head down as well just to check. So yeah, we've got a few people. Thank you so much for watching, whoever you are. I will just reiterate this, that if you do have any questions for Delaram, then please do pop them on the comments, because we would love to hear from you. So any questions, what we'll probably do is I will keep an eye out for the questions, and then we can I can relay those questions to you towards the end, because you do, I believe, have some slides and a bit of a presentation for us tonight. Is that right?
Yeah, that's
Super.
correct.
Okay, so well, I'll say to you, if you want to share the screen, take it away.
Yeah, sure.
We're watching avidly. Go ahead.
Going to share my screen now, hopefully no hiccups, and I will get started. So yeah, I have introduced myself, told you a little bit about me and what I do as an ambassador for Skcin. So I'll get started. So the sun emits UV radiation, as we know, which is a known carcinogen. Where the damage accumulates, it's irreversible, and the consequences of the damage can ultimately result in death. Now, in the UK, skin cancer is one of the most common cancers, and the incidence is rising very quickly. Approximately 15,000 patients are diagnosed with melanoma in the UK each year, and over the last decade, the incidence of melanoma has increased by 50%, which is very alarming. Now, amongst the 15 to 34 age group, melanoma is one of the most common cancers that kills, and it's been estimated that by the year 2024, melanoma will become the most common form of all major cancers in the UK. Now, the most important fact to stress is that over 86% of all skin cancer cases and 4 out of 5 deaths caused by melanoma are preventable. And this is where Skcin as a charity comes in. We know that one of the biggest issues is education. People just don't think that skin cancer will affect them unless they know a close friend or a family member who has suffered from it, or they personally encountered it themselves. And it's this lack of education surrounding the cause of skin cancer itself. So for example, it's not common knowledge that when you tan, you're actually causing DNA damage to your skin. There's also a lack of education around sun safety and the detection of skin cancer, so the signs and symptoms to look out for. And unfortunately, skin cancer doesn't have much of a profile, so you hear more about other sorts of cancers than you do about skin cancer in general news and social media, and so we need to accept the responsibility of promoting a change and improving education. So UV radiation, as you know, is emitted by the sun. It's not related to temperature, so a relatively cold or cloudy day will still have a level of UV radiation. And this radiation can't be seen, it can't be felt, and so we're not always aware of the effects that it's having on our skin, despite it being carcinogenic. Almost all incidences of skin cancer are caused by the overexposure of the skin to UV radiation. So whether that's in the form of the sun itself or from activities such as sunbeds. And this damage that's caused by UV radiation is permanent. It can't be reversed. And each time the skin is exposed to UV radiation, the damage increases and it accumulates. So how does UV radiation actually damage our skin? So we know that the sun emits 3 types of UV radiation. So that's UVA, UVB, and UVC. Now UVC is filtered out by the ozone layer. So if we concentrate on UVA and B, the UVA rays affect the outer layer, the UVB rays affect the outer layer of the skin. So that's known as the epidermis. And these are what we call the burning rays. So they're the primary cause of sunburn and they're a big contributing factor to skin cancer. Now the UVA rays are able to penetrate deeper into the skin, so this is known as the dermis, and while they also contribute to sunburn and skin cancer, they're also responsible for the wrinkling and the aging of the skin. So both UVA and UVB rays suppress the immune function of the skin, which is there to protect against the development and the spread of skin cancer. And again, an educational point to stress is that the sunscreen that you pick must have both UVA and UVB protection. So when you look at a bottle of sunscreen, the SPF, so the sun protection factor, relates to UVB protection. The higher the better, and it's recommended to use a factor of 30 or above. And the stars on a bottle of sunscreen correlate to the UVA radiation, so this is usually out of 5, and it's recommended to use the sunscreen that has a rating of 4 or more stars. Now this image here shows exactly how UV radiation damages the skin. So on the left is a cross section of the skin without any sun protection. So you can see that the UVB rays are penetrating the superficial aspects of the skin and the UVA rays are penetrating deeper, causing a loss of moisture and resulting in the skin either turning red or brown and therefore causing damage to the cells of the skin. The image on the right shows the skin with the protection of a sunscreen. So you can see that the sunscreen is filtering and reflecting the UVA and UVB radiation from the sun, and therefore it's reducing the overall risk of sustaining sunburn and damage to the cells of the skin. Now, a lot of you will have experienced sunburn, whether it was accidental or whether you were trying to tan your skin by sunbathing and you burnt instead. And we know that it's caused by overexposure of the skin to UV radiation, and it's this exposure that causes the skin to release certain chemicals, which results in the blood vessels within the skin expanding and leaking fluid. So this is when you get that classic swollen, painful, and very red sunburnt skin. And without the protection of a sunscreen, this UV radiation can penetrate into the skin, which causes the DNA cell damage that leads to skin cancer. One of the key points in education is that skin cancer can actually affect all skin colours. So amongst patients with darker skin tones, especially those with Fitzpatrick skin types 5 or 6, skin cancer usually isn't on their radar, so they don't think that it will affect them. And so a lot of people with darker skin won't use sun protection. However, we do know that those with fair skin, so those with blue eyes and red hair, tend to burn a lot more easily. And therefore they're at greater risk of sun damage by UV radiation. And those who are avid sun worshippers and use sunbeds are actively increasing their risk of developing all types of skin cancer. Now, additionally, those who work outdoors, so for example, gardeners, builders, or take part in outdoor sports or leisure activities are also at greater risk due to the prolonged exposure to UV radiation. Now, sunbed use is something that hasn't been tackled very well so far in the UK. And in one of my initial slides, I spoke about the increased incidence of melanoma in the 15 to 34 age group. And this has been directly linked to the use of sunbeds. Now, sunbeds give out the same UV radiation as the sun, but at around 10 to 15 times the intensity of the midday sun, which is a huge amount of radiation. And I've actually personally overheard people coming into beauty salons to use sunbeds to prep their skin in a bid to protect it before going on holiday. And this is just not true. All it does is it increases the cumulative damage to the skin and it increases the risk of skin cancer. And not only does sunbeds cause damage that we can't see, but it also physically affects the skin. So it causes premature aging, wrinkling, sagging. It's that classic leathery look to the skin. It's also a misconception that if you use sunbeds infrequently, then it won't harm your skin. So actually, even just using a sunbed once a month can increase your risk of developing melanoma by over 50%. Now, UV radiation isn't all doom and gloom. Some exposure to UVB radiation can actually be good for us because it produces vitamin D. And vitamin D has become a hot topic during the COVID-19 pandemic. And we know that most of us in the UK, especially those of ethnic backgrounds and darker skin tones, are deficient in vitamin D. But it's also important to remember that although some sun exposure is good for us, it's the overexposure to UV radiation that poses a serious health risk. And so it's all about moderation. It's a common question regarding how much sun exposure is good for us and how much sun exposure will result in vitamin D production without increasing our risk of sun damage. And there's no definitive answer, but for most of us, around 15 minutes a day and an amount of sun that's going to emit UV radiation that's well below the level that would cause sunburn, so avoiding the midday sun, is sufficient and safe. And we can also get vitamin D from a healthy, balanced diet or supplementation. So dietary intake of vitamin D can be increased by eating foods such as egg yolks, fatty fish, and a lot of everyday foods such as milk, orange juice, and cereal is actually fortified with vitamin D. And it's important to note that actually vitamin D can be toxic in high levels. And so it's important to ensure that you're not taking more than what is recommended. So the main message from this section of the presentation is that the prevention of skin cancer is so much more efficient than trying to cure it. Now, Skcin as a charity has created 5 simple sun-safe strategies that can be used to decrease the risk of developing skin cancer and to try and prevent the majority of cases. So when UV radiation is increased to 3 or above, it's advisable to adopt the 5 S's of sun safety. So these include slipping on some protective clothing, slopping on a high quality SPF 30 or above sunscreen, slapping on a wide brimmed hat, sliding on high quality sunglasses, and seeking shade whenever possible. So if we go through these one by one, so clothing is actually one of the most effective ways to reduce the exposure of our skin to the sun. So ideally we should be covering our shoulders, but covering as much skin as possible is recommended. And the closer the weave of the fabric of the clothing that you're wearing, the better protection that's provided to our skin. Now, any areas of the skin which are not covered by protective clothing should be protected with sunscreen. So always use the sunscreen with an SPF of 30 or above. And this means that, for example, if you would start to burn in the sun after 10 minutes, applying an SPF 15 sunscreen will protect you for 15 times longer than that. So that means that you're protected for up to 150 minutes. Now, as I've mentioned before, you should ensure that it's a broad spectrum sunscreen so that it also carries a UVA symbol, so the minimum 4-star rating. And the sunscreen that you're using should be stored in an accessible and cool place, which can be quite tricky if you're out on a very warm day. And it's also really important to check the expiry date. So it's really common that you'll go on holiday, maybe not use all your sunscreen, pop it in a drawer somewhere, and then the next time you go on holiday again, you're using the same bottle of sunscreen that's now out of date and therefore will not adequately protect your skin. And in order to get the best protection from sunscreen, you should apply a generous amount to clean, dry, exposed skin around 20 minutes before you're going to be exposed to the sun. And it should be reapplied every 2 hours and after being in water in order to maintain the protection, and applied more often if you're going to be particularly sweaty on a hot day. Also, don't forget your lips. So always use an SPF 30 or higher lip balm for when you're in the sun. Now, it's also a good idea to wear a wide brim hat that provides shade to the face, the neck and the ears, and the more coverage the better, in order to effectively protect the skin at the head and neck. And again, similar to clothing, wearing a hat with a close weave fabric will provide the best protection. UV radiation can also damage the eyes, and so it's really important to wear high quality sunglasses. So when you're buying sunglasses, always look for the European CE mark, which will indicate a safe level of eye protection, especially those which are labelled with a higher EPF. And make sure that your glasses are close fitting and wrap around your face in order to stop UV radiation from entering through the sides or from the top of your glasses. And yes, high quality sunglasses are more expensive, but it's definitely worth protecting your eyes from the damaging effects of the sun. And lastly, shade. So sitting in the shade will act as a barrier between the skin and the sun. Try to get as much shade as possible, especially during the peak hours of 11 a.m. to 3 p.m. But don't rely on shade alone. Make sure that you're protecting your skin with sunscreen and clothing. Now, the next section that we're going to cover is the identification of suspicious lesions and what to look for on the skin that might make you think that a lesion might be skin cancer. Now, the sooner a skin cancer is identified and treated, the higher the chance that an individual will be able to avoid surgery, disfigurement, and in the case of melanoma, very serious consequences such as death. Now, I know that most of our audience today won't be medically trained, but the aim of educating about the signs and symptoms of skin cancer is to raise awareness for you to be able to alert people to a suspicious mole and say that, have you noticed it? It looks suspicious, and I'd encourage you to go and see your GP or your dermatologist. And this can occur in everyday situations. So you might be out for lunch with your friends and you notice an odd looking mole on their arm. You might be a beauty professional and you notice that your client's got a suspicious looking lesion on their neck. And many barbers have picked up melanoma on their clients' scalps. So that's why education is so important. So we'll start with basal cell carcinomas. So these are the most common type of non-melanoma skin cancer, and they tend to affect the areas of the skin which are exposed to the sun. So this is the head, the face, the neck, and the ears, and they're very slow growing, and it is quite rare that they would spread. And they come in all different shapes and sizes. Large basal cell carcinomas which are left untreated can cause extensive local spread, and therefore they can cause disfigurement. So what can you look out for to detect the early signs and symptoms of a basal cell carcinoma? So any bleeding, oozing, or crusting sores that are persistent and they're difficult to heal are suspicious of a BCC. Also a pearly or shiny looking lump or bump, which can be pink, red, or white in colour. However, the growth could also be tan coloured or brown or black, especially in people of darker skin tone, and therefore can be confused with a normal mole. And something that we look out for, and particularly with a BCC, is a rolled edge. So where the border of the growth is slightly elevated, which you can see here. And there may be a dent in the center. And as this lesion grows, you can develop small blood vessels that are visible on the surface of the growth. Now, BCCs aren't always raised. They could look like a patch of red or irritated skin, which may occur on the face, the chest, shoulders, arms, or legs. So any area of the skin which has had a lot of exposure to the sun. And these patches may crust and they may itch or hurt, but also they could have no symptoms at all, which is quite common. They may also look like a white, yellow, or waxy looking scar, and this is a warning sign that actually the basal cell carcinoma is much larger than it seems from just looking at the skin. Squamous cell carcinomas are the second most common type of non-melanoma skin cancer, and these also affect areas of the skin which have been exposed to the sun. So similar to BCCs, they can present in different shapes and sizes, but the difference is that they grow at a faster rate. So they also rarely spread, but the risk of this is higher in squamous cell carcinoma than in basal cell carcinomas, and therefore they can become life-threatening. So as they grow rapidly and enlarge quickly, they can cause discomfort and disfigurement quite rapidly as well. So squamous cell carcinomas usually present, again, persistent, thick, rough or scaly patches that have a tendency to bleed. And they can often look warty, or they may look like open sores with raised borders and crusting, and they can be quite painful. So what can you look out for to detect the early signs and symptoms of a squamous cell carcinoma? So they often initially appear as small, hard white or skin-coloured raised growths, but they can also present as persistent, scaly red patches with irregular borders that can crust and bleed. Like BCCs, they can also look like elevated growths with a central depression, as you can see here. And these variants of SCCs can rapidly increase in size. Lesions which bleed or crust tend to persist for weeks on end, and the person may tell you that these lesions are not healing. And additionally, you should look out for warty-looking growths as well, because they could turn out to be a non-melanoma skin cancer. We're going to move on to melanomas now, so what these lesions are and how to detect them. Now, melanoma means black tumour, and these lesions originate in cells called the melanocytes. So these are cells within the skin that produce the pigment melanin and are responsible for giving colour to the skin, the hair and the eyes. And these melanin-producing cells also form moles, and it's possible for a melanoma to originate from a normal, healthy mole. Now, melanoma is a form of cancer, and these cancerous growths develop when DNA damage to the skin cells from UV radiation triggers certain mutations, and this leads to the melanin-producing cells to rapidly multiply and form tumours, so i.e. melanoma. So one advantage that melanoma has over other cancers is that it can be visualized. So we can see these lesions on the skin, which makes it easier to detect in the early stages of the disease. However, if it's left undetected, this is when melanoma lesions have the opportunity to spread to other sites and organs. And once this happens, it's known as metastatic melanoma. So metastasis means spread, and it's very difficult to treat. Common organs which melanoma spreads to are the liver, the lungs, the bones and the brain, and at this stage of detection the prognosis can be quite poor, which is why education is so important. So the way that we detect melanoma is using the ABCDE rule. So this is a very common tool to compare the appearance of normal moles to melanoma lesions. But with such variations, skin cancer may not always look like what you would expect it to. And so anything that seems new or unusual or different from the norm for an individual should be checked out. So the A in ABCD stands for asymmetry. So this is where one half of the lesion doesn't look like the other half. So you can see this quite clearly in this image. So if you draw a mental line down the middle of the lesion, you'd be able to easily identify that there's no symmetry. However, if you look on the right, then there's a uniform appearance to the healthy mole. B stands for borders, so where the borders of the lesion are uneven, they could be irregular, ragged, or the border has a blurred or an undefined edge. And again, if we draw a mental border around the lesion, it shows that there's no regularity, whereas if you look at the healthy mole, it looks as round as it can be and therefore has a regular border. C is for colour, so this is a really important sign to be aware of because any change in colour of a lesion or variations in colour, mainly more than 2 colours, is a worrying sign. So colours such as red or black or blue may signify a melanoma. So in the image on the left, you can clearly see that this lesion has around 3 colours that I can see. So it's dark brown or black around the left side, with some brown tones in the center and more reddish brown towards the right. And this is in comparison to the normal mole on the right, which is all light brown. D stands for diameter, so generally any lesion that's bigger than 6 millimeters in size should highlight suspicion. So the melanoma on the left is approximately 10 millimeters in size, whereas healthy moles are usually quite small. And also from this image here, you can appreciate the ABC signs as well. So the melanoma growth is asymmetric, it's got an irregular border, and it's got more than 2 colors. And E is for evolving. So one of the most important indicators of melanoma is if there's been any change to the lesion. So for example, in the melanoma image, it seems likely that there was an initial lesion, which you can see in this upper right corner, and this has then evolved to spread out further. So again, the lesion's asymmetric, it has an irregular border, and there's more than 2 colors. And the lesion's approximately 7 millimeters in comparison to the healthy mole on the right. What's helpful to remember is that melanoma usually stands out. So this is what we call the ugly duckling sign. So where the suspicious mole looks very different to any other moles, marks, or spots that somebody may have on their body. And if this is the case, then it's a good idea to have a closer look and to talk to your client or your friend or family member about the characteristics of that suspicious mole, and maybe ask them about any risk factors. So have they had a lot of sun exposure? Do they have any family members who have had melanoma? Have they had any previous melanomas themselves? And as we know, the sooner a potential skin cancer is identified and treated, then the better the chance of avoiding any surgical procedures, and in the case of melanoma, potentially avoiding death. So this is why education plays a huge role in being able to identify what's suspicious and being able to signpost people to their GP or dermatologist to have it checked out. Now, in the last few minutes talking to you, I just wanted to mention Skcin as a charity. Obviously, I am an ambassador for Skcin. And the main objectives of the charity is to raise awareness of skin cancer and to promote the importance of sun safety and early detection through national education programs and campaigns. Now, MAST, which stands for Melanoma and Skin Cancer Early Detection, is a national accredited education program for hair, health, and beauty industry professionals. Now, individuals in these job sectors have access to areas of people's skin that's more hidden or not looked at in great detail. So as I mentioned before, barbers looking at the skin of the scalp and ears more closely, nail technicians noticing signs on nails, and beauticians who carry out facials or waxing, seeing areas of the body up close to notice more potentially subtle signs. And so educating these professionals was vital in the process of combating skin cancer statistics. Now, again, the point of the education program is not to diagnose the skin cancer, but to be able to pick up the right signs and symptoms, to signpost people to seeing their GP or their dermatologist as soon as possible. Now, the MAST course is an e-course, so it's all online, it's £20, and when you sign up, you receive a guide in the post, but there's also an online guide that you could use. And you study this guide and you do the course in your own time, so you don't have to do it in one sitting, and then you'll receive a certificate of completion. And the website to sign up for the course is just shown on the screen below. Now, Skcin are also in the process of developing an app to provide users with instant access to advice and guidance related to the risks of UV radiation, how to prevent skin cancer, and how to check your skin for early signs and symptoms in order to tackle the rising incidence of skin cancer through educational intervention, which is all very exciting. So do keep an eye out for this app. And that's it from me. It's been a pleasure talking to you all. And if you've got any questions, then please feel free to fire away.
Wow, wonderful. Thank you so much, Delaram. That was, well, just hugely informative. I was captivated. And I can't believe that time has gone so quick, actually. Oh, now, do you need to unshare your screen? I'm just looking, or do I need to unshare? I'll let you do that, and then
I need to do it, but I'm just trying to. There we go.
Don't worry. Take the time. There we go. Perfect. Yes. So wow. Yeah, as I say, I can't believe how quick that time went. I was captivated, as I'm sure all of our audience watching were, because it's a little frightening. There's no getting away from it, but we have to have that realization. It's the reality check that is what is going to educate and make people start to be aware, start to notice.
Absolutely.
Particularly when we're looking at mold, and it could be, obviously it could be somewhere that you're not seeing, you know, how we're saying, and rightly so, that skin therapists like myself and my colleagues in the Skin Collaborative, there'll be professional you know, beauty therapists, skin therapists who are watching, who I know follow our page, hairdressers, that we are in such a fantastic, unique position to be able to spot, you know, potential signs of skin cancer. And of course, there is, we are not expected to be diagnosing anything, but if we have this in our remit to spot those signs, then we can say, look, I really feel that you need to go and get this checked out, and that could potentially save someone's life. So it's massive, isn't it, really? So let's talk a little bit about, I will just keep checking, because actually I'll have a look at this moment in time. There's a couple of comments. So thank you, Aggie Singh. Thanks for watching, Aggie. She has said that she, I have just renewed my yearly masked course. It's so easy to follow. So that's fantastic.
Fantastic. Great news.
And she also said it's, and just reiterating a bit further down, it's just so worth taking the course. So we will touch on that a little bit more, I think, before we go. Teresa, hi Teresa, she is part of the Skin Collaborative. She has said all of us in the Skin Collab have done our mask training for the protection of our clients, and this is
absolutely
it. Just reiterating what I just said, that the unique position we're in, and I think the masked training is just fabulous and so good, so straightforward, but very powerful. It's really, really good. Let me just have oh, and Anne, hi Anne Martin for watching. Thank you so much. What an informative session. So that's lovely. So yes, before we head off, let's just reiterate again about the masks. So do people need to go to skin.org, or is that the website they would go straight to then go onto the masked course?
So you can get onto that through the Skin website itself, but if you were to just Google masked, it comes up straight away. Now, MASK was the original accreditation program, so that's for hair beauty professionals. There's also MASK Pro, but this is for healthcare professionals, so doctors, allied health professionals, etc.
Oh, super. Hang on. Oh, we've got, so Eleni says, I never get bored of watching this. It's always fascinating and very interesting. Thank you so much. Oh,
thank you.
That's lovely, isn't it? And Aggie also says, which actually I was going to say, so you just reminded me, Aggie, she says she's very excited for the app coming soon.
Yes. Yeah, I think that will be very easy to access all the information. It's there on your phone. So if there's any sort of worries or thoughts, you don't have to go traipsing through the internet on the websites, all there.
Yeah, and this is how we roll now. We all love an app for something, don't we? So I think that's very, very exciting. So that's coming soon. Rough launch date, is that in the coming weeks, or will that be a few months away, or?
I'm not sure of the exact date, so it's recently been sort of put out there that this app will come about, but I think it should be within the next few months, I hope.
Good. So
keep your eye out.
Super. I would hate to miss out anything before we wrap up. Oh, and also which you touched upon, the quality sunglasses. It's actually Aggie's mentioned it on here, but I tend to say it a lot as well. I just think, you know, that can be something that can get ignored, and it's just as important. So it's having the right eyewear, but paying a little bit more, but making sure it's got that quality seal on it is really, really important. We're just about to wrap up, guys. If anyone wants to get a quick question in at the end, just a couple of bits that I want to highlight just personally. I just think it's mind-blowing. I mean, we are more and more aware of the dangers of sunbeds, yet they are still so common on the high street. They seem to still be everywhere. But you know, that's a bit of information you gave us about even just using a sunbed once a month can increase your risk of skin cancer by 50%.
Huge.
I mean, that's staggering. That really, really is. And the great advice with the sunscreen and the expiry date, because I think that's so easily done, where you can check, oh, there's loads left in there, check it in the cupboard. And actually, you know, you could be putting yourself at huge risk. So again, it's a very easy mistake to make, but I think that's really, really good advice. And yeah, just, you know, the looking at particularly the changes that we're looking out for, and the rolled edge on a lesion, I think that's quite specific, is so I just thought I wanted to highlight that. For me, those bits, I just think actually, you know, are, you know, like I say, you can't get away from the facts, and they are scary, and it's not meant to give anyone nightmares, but it's the education, isn't it?
Definitely. Yeah, I completely agree.
Super. So I think we'll wrap it up there. Delaram, is there anything that you wanted to add? I mean, you've so eloquently put everything this evening. It's been a joy. You know, even with what I know, I've still learned things this evening. But if there's anything else you'd like to add before we go?
No, I don't think so. Just thank you for everyone for listening. Like we've said, it is so, so important. So the more we get the message out there, then the better, in order to prevent skin cancer. So yeah, thank you so much.
Oh, thank you. It's been wonderful. And I would just like to say that if you want to check out the charity Skcin, it is Skcin. So you go to skcin.org and have a look at all the wonderful things that the charity are doing. So thank you so much for your time this evening.
No problem. Thank you. My pleasure.
Thank you to everyone who's watching. We love all your support. So yeah, have a great evening, everyone. And actually, I will just finish the weather mostly in the UK. So if it's not great with you, I apologize. But mostly we've got some really nice weather coming up. Delaram and I were saying just off air at the beginning that guys, enjoy it, because it's been a little late coming, but just enjoy it safely. I think that's the thing to end on, isn't it? Yeah, super. Absolutely. All right. Take care, everyone. Bye-bye.
Bye-bye.